Namaskar. Hello, I'm Dr. Soni Shrestha. I'm a GP, general practitioner, currently working in the UK. I do run the Health Awareness YouTube channel where I normally post a health-related topic in Nepali, but this is entirely in English, and it is a very special episode asked by many of you regarding the journey of UK doctors. So today I have a very special guest. It's a Dr. Yvonne Marsh. She's a foundation doctor, and we'll be talking about the journey of medical school and after the medical school getting first job. And I hope this will be beneficial for someone who want to consider studying medicine or who is already studying medicine and finding the first job. And also it will be beneficial for someone who is understanding what is foundation training program, how does it works. Okay, shall we start?
Yeah, sure.
Welcome, Dr. Marsh. It's
Hello.
Dr. Yvonne Marsh.
Yeah.
So we'll be talking about the different journey.
Yeah.
And I'm going to ask you a few questions.
Yeah, sure.
Okay, the first question I would like to ask is very common question we get to ask is why you wanted to be a doctor or went to the medical school.
Yeah, that's a good question. Yeah, I think there's multiple different reasons why I wanted to do it. I think I really enjoyed science growing up in high school, and I found that medicine was maybe like a practical way of applying science, and as cheesy as it sounds, like I really do enjoy to help people and using that kind of knowledge and things like that to try and help people and to make people better. I think it was something that I really wanted to do, and I also felt like we can kind of live our whole lives in this body and not really understand fully what's happening in the body, and so I felt like medicine was a way to kind of try and educate people about their bodies and how to take care of them through their life for a better, healthier life. So yeah, I think that's kind of why I wanted to do it.
Yeah, that's great. And the other question is how we get into medicine. What are the criteria, how you apply? Could you tell us a bit more?
So it was many years ago that I did it.
I know.
But so things might change slightly, but I think the main principles will probably be the same. But I applied in year 13, which is our last year before last year of school, and so I applied in the winter time of that year, and you first have to look at what kind of universities you want to apply to. So you have to look in the country on different websites and things like that to see which universities you want, and then based on those universities, each one has different entry requirements. So you look at what grades they require. Sometimes they require extracurricular things, or sometimes they require additional tests as well. So Birmingham didn't require, I went to Birmingham, but Birmingham didn't require any tests at that time, but I know now that they require a UK CAT test, which is an aptitude test that you have to do. And most universities either want the UK CAT test or the BMAT test. So those are the two different ones that they require. And then so after you do those tests, and you have to do a personal statement as well for the university, you apply via UCAS, which is a specific website, and you can apply for 4 different universities for medicine. So you just sometimes have to be a bit smart about which ones you apply to, and looking at the entry requirements and see which ones you fit most for, but also looking at location, so if it's which one's closest to family and things like that. So then after you apply, then you get invited for interview, and then after the interview, then you find out if you got in or not.
It's kind of a long process.
It's a long process,
and criteria could be different, isn't it? And also other thing is, lots of people say medicine is very tough, it's difficult, and it's a 5 years journey, isn't it? And all of a sudden from school getting into the university is kind of big change. How did you feel your journey these 5 years? Because it's lots of exams, how did you find?
It was very up and down. It was challenging for sure, because it's a lot of content to cover, and you feel quite a big responsibility that you need to learn this information, not just for yourself, but because you're going to be helping people in the future and taking care of people's lives. So it has a bit of bigger responsibility. So yeah, it was difficult for sure, but I think I mostly learned that staying organised is what helped me the most.
Yeah.
So my first 2 years, it was kind of called preclinical years. So we covered mostly the science behind everything. And then, so that was more like proper university kind of time. And I think that was, again, just to be organised with the information and the different modules that I was doing, to stay on top of all the workload so that you can do well in exams. And then the last 3 years are more clinical, so it's more, you do a lot of hospital-based medicine, so a lot of placements and things like shadowing. And those exams were slightly different because you had OSCE exams, like practical exams. But I think my main advice would be just to stay organised. Of course, some people, maybe medicine's not for you, and that's okay, but like, I think if you stay organised and stay on top of everything and stay disciplined with it all, then you can kind of get through it. I would say.
Yeah, I quite agree with you. As you said, you know, the main thing is being organized and the discipline, isn't it? Yeah. Because it's not only about knowing; it's also about lots of exam. Yeah. And also, as you said, during that, you know, the theory bit. First, preclinical is obviously a theory and exam, but the other one is the clinical OSCE, like apart from your normal working periods or the study period, you have to do lots, isn't it? You have a group discussion, out of practice works. These are quite a lot of time as well, isn't it? So if you are disciplined, I think you are organized better, isn't it? And then, for sure. Again, it's I think the main stress is exam one after another, and then also, as you said, once you finish the university and you're working independently, it's kind of, you're dealing with someone's life and you have a big responsibility for that. For sure. And that can put you a bit of extra stress that, how I'm going to do this, isn't it? It has to be, they're really good organized and then good with clinical as well as your organization skill, isn't it?
For sure.
And also, because it's as we talk about the loads of exam, and some people may not able to, clear at one attempt or first attempt. Yeah. How does it work in the,
Yeah, so I guess every university is different, so I can only speak for like Birmingham and how it was for me, so I don't know if they've changed it. But when I was sitting exams, they allowed you to do a second sit if you did fail. But your result for that second sit would be capped. So even if you did really, really well on that second time, your result will be capped at 50%. So it is a lot compared, it's a lot of decrease. But of course, if you had exceptional circumstances or circumstances which you couldn't help during your first sit, which made you fail, then they do take that into consideration and they're quite understanding about that. So I think it's to try and pass it the first time, but of course sometimes we can't, and
it's hard. And again, 50% is quite a lot. It's significant, and also that may not only affect that time, but as a longer run, isn't it? Finding the job, you might not get the placement. It's hard. Okay, so getting into first attempt is the main thing, isn't it? And other thing is, talking to different medical students, they said apart from studying medicine, they are doing lots of different activities. Because lots of people feels like, medicine is tough. When you're in medical school, you might not able to do anything at all. So how is your experience apart from the studying? Do you do anything other extra activities?
So I think university is a great time to just try different things. Like, you just try different activities and see what you like. You can do something for a year or so and then try something else. So I did swimming quite a lot, so I was part of the medical school swimming club. So we did swimming like twice a week, and that was really nice. It was just a kind of a de-stress activity, and do it with your friends and things like that. And I also did like some frisbee for 1 minute, like just random things that you can just do. And I think it's just finding something that's good for you. And you don't want to, sometimes some people are really good at doing lots of different things whilst keeping on top of medicine. I felt like I could only do a certain amount of things, otherwise I'd get too stressed. So the activity was stressful rather than enjoyable. So I think it's just every person's different, but it's to find something that you enjoy that's not a medicine, really.
I quite like the way you said that every person is different, because knowing what works for you is most important, isn't it? because although apart from the medicine is already stressful, but the doing some activities should relieve your stress rather than putting you extra stress.
Yeah, true.
And at the same time, because it's, there are lots of different people, as you said, does different things. And when you're doing that things during the medical school, you may not realize how important that is. But when you're coming after, for example, for me, I have a different trainees and talk about that. And coming back and looking after or the look back, then you realize how important that is, because it's not only for building up. Medicine is not about only knowing your clinical knowledge. At the same time, there's a lot to do with the organization skill, your leadership skill, your time management, isn't it? And that definitely helps, because as you said, you're running the swimming club, that, and that's also give you the experience about how you manage your time, how your leadership role comes, and it as a long run it helps you, and also help you to boost your resilience, isn't it?
For sure.
So it's always in the ups and downs, isn't it? It's not easy, so that's really good. That's I think we should encourage for everyone to do something extra apart from medicine. It's not only about knowing everything about medicine, but not knowing, because it's maybe difficult during the hard time. It can be, isn't it? And other thing, after you have 5 years, you qualify, and different, the university have a different degrees. Like mine is MBBS, but yours is slightly different. Can you tell us a bit more?
Yeah, sure. So mine's MBCHB, which is just a fancy way of saying medicine and surgery, I think, in Latin. So I'm pretty sure most of the UK universities have MBCHB, but I'm not 100% sure. But definitely Birmingham is MBCHB.
But even though it's a different, but it's
the same. We learn the same things.
Medicine. I agree. And how is your experience about getting the first job? Because once your medicine done, 5 years of university, and we were like so happy it's all done. And there's another new journey starts, isn't it? And it's like, so we have to get into the job now. And here's a slightly differently, because all set up, which is very organized, isn't it? So could you tell us a bit more about, after medical graduate, how do you get into that training program?
So it's a very kind of organized system. So you apply in your 5th year or your final year of medicine, because some people do 6 years, so it's in your final year, and you apply in kind of the October time. And at that time you apply through a website called Oriel, and this is the website that the most like all of the UK hospitals use. So how it works is that you, based on your grades from the whole of the 5 years of medicine, that gives you you're put into centiles, so you're ranked according to the rest of the people in your year, and then based on that that ranking, you get a specific amount of points, and then that's worth 50%, and then you do an exam called the SJT, which is called the Situational Judgment Test, and that's worth 50%. And based on those two, you can get additional points for doing publications or having additional degrees or things like that. That gives you a combined score, and that combined score then ranks you according to everybody in the country, to help determine where in the country you can work. So every hospital in the UK is part of a deanery, and deanery is just a collection of hospitals in a specific area. So the first stage of the application process, after you've done the SJT, or you actually apply before the SJT, but you rank all the deaneries in the UK according to which one you want to go to first. And then depending on how many people apply to that, because there's only a set number of places, they allocate you to that place if you're if you beat the rest of the people applying, if that makes sense. So that's the kind of the first step, and then the second step is, after you've done that, then you apply for the jobs. So you apply for kind of sets of 6 jobs, which is different rotations in either hospital and community. And again, you're compared against other people who are applying for the same job, and whoever has a higher score would get that job. So you again rank all the jobs in that deanery. So that's kind of how it works. But
and then SGT, that exams is a MCQs kind of multiple choice question.
I think they've changed it slightly, but it is definitely still a multiple choice question. But it's kind of there's different types of questions in the SJT, but you have like a ranking question of what you would do, what is most appropriate to what is least appropriate, and then you have a choose 3 options, which you would like do in that situation. And I think they have a video questions now, so it might change slightly since I did it, but that's how,
it's kind of like a processing your thought, and also it's lots of practical skills, isn't it? And also this it's good to have a national program, so you don't have to worry about the users applied, and then if you have done well, then you have a pride to do go wherever you want to go, which is really good. And after that training, after that exam, and then you get into the foundation training program, and which is the 2 years, isn't it? F1, which is the foundation year 1, and F2 foundation year 2. And obviously, as you said, it's a different placement, isn't it? 2 years varies in the different placement. And how you feel about the foundation? Could you tell us a bit more about this foundation program?
So, like you said, it's the F1 and F2. So F1 is kind of a very supervised year. So you're called provisionally registered. So you're not fully registered with the GMC yet. So that means that you have to be supervised a lot more in that year. And then F2 is a little bit less supervision, but you're still in this kind of training period. So that's F1 and F2. And F1, both F1 and F2, you have 3 rotations per year. Some hospitals it's slightly more, but most it's 3 rotations per year. And it's quite good because you get a mix of lots of different things. You get a bit. I did renal medicine first. Emergency medicine first, and then renal, and then general surgery. So I got a big mix and variety. And which I find quite good because you can learn a lot and gain your skills, and even if you don't want to do that specialty, it won't harm you learning about that specialty. I think it will benefit you.
I quite agree, and then I also quite like the word foundation, isn't it? Because it's like a foundation for your career
the
rest of the career, and then as you said, it's a different placement, different speciality. So you have the opportunity to learn different before you decide what you want to do next the rest of your life, isn't it? Rest of your career. And also in every placement you have your own mentorship, like a clinical supervisor, educational supervisor. And could you tell us a bit more about why it's important to have the supervision or the mentorship?
I find it really useful. So we have this educational supervisor who is kind of the overarching supervisor who's there throughout the whole year, and then we have clinical supervisors who are there in each rotation. And it's quite good having a clinical supervisor for your specific rotation, because they know that rotation, like that specific specialty the best, and they can help you if you have any problems with that specialty. But then I think sometimes people can have difficulties with like a clinical supervisor, or then maybe their problems are not being heard or anything like that. So then you have that overarching educational supervisor as well that you can escalate to. And also it's for well-being as well, that if they can look out for you, and you have somebody if you are struggling with your well-being, both the clinical and the educational supervisor. So I think it's a really good kind of support system for foundation trainers.
It's very important, isn't it? Because the role of the supervisor, and especially clinical supervisor, is working along with you together, is in the same place, isn't it? And also not only helping you or supporting you through the clinical needs, but also as a person overall, isn't it? Is there any other problem you are going through, or are you having difficulties choosing the right the career path, or and lots of different things, isn't it? Or someone may struggle, because at the end, doctor is also the person, isn't it? You might have your role, professional role, but then behind that you might have your personal circumstances and lots of stress and all, and the role of supervision or the supervisor is supporting through that, isn't it? So it's really important to have a good rapport in between the trainee and the trainer, isn't it? So that's really important. And the other thing is, sometimes people tend to get the year out, after the foundation training, not necessarily getting into the another training program. Why do you think that's important?
So everyone's different. But I think now it's becoming a bit more of a trend that a lot of people are taking what we call an F3 year, which isn't like a year that is set by like, it's not foundation training years, it's actually only 2 years, but you can do more foundation years if you want to. So a lot of people are doing it to kind of gain more experience in different specialties that they find interesting, or if they're not sure what they want to do in the future, so instead of going straight into training, they get a bit more experience in different places by locuming or something like that, or even going abroad and working abroad to see how that is as well. So I think that's maybe why people are doing it at the moment, kind of gain more experience and
I agree, because in the past it's not very common, but as you said, I can hear like lots of training doing like I'm taking a year out, and I think that's really good in a way. You know, looking back, like for me, is also I have done lots of different training before I consider as being a GP, and that's every training or every exposure has own value, isn't it? And also, as we said, at the end, no matter what specialty you take, you're going to complete the training. You will be in the specialist at some field. But again, it's maybe 8 years, maybe 10 years, maybe a few years. But I think the journey is important, isn't it? Getting through, the destination, but going through journey should be enjoying and then gather the experience. Experience has the most important value in our clinical practice as well. And have you decided what you're going to do after this?
After F2. So I'm thinking about GP training. Correct answer. Yes. But I don't think I'll go into it straight away. I think I again want to kind of take some time to try different other specialties to gain more experience. Considering maybe working in Australia for a little bit, I'm not sure, but I think GP is kind of where I'm heading. I'm really I found it is very challenging because I'm in this GP rotation at the moment, but I find it really rewarding, and I feel like I could see myself doing this rather than any other kind of specialty. So
okay, thank you. Really, they're very pleased to hear that, and I will be looking forward to see you as a GP trainee or finishing GP. And also, as you said, as we discussed earlier, like every experience has a value, and then also most important things is keeping mind open, isn't it? You don't have to necessarily decide what exactly you want to do, because once you have made a mind, sometimes you might be overlooking the opportunity coming along, because although this is the clinical work mostly, but we have lots of opportunity like educational, other leadership and other training, and I think it's good to just take it as it comes. As you said, you might going to Australia, there might be a different opportunity, and also seeing the completely different world, isn't it? So that's enjoying again the path rather than say, I will be GP and then I will straight dive into the GP.
I don't want to go straight. There's a lot of responsibility.
And also you said it's a GP is also challenging. It's not kind of like easy. I mean, none of the speciality is easy, but the GP also there is a kind of time restriction. There's lots of things, and also in the GP. Not only we deal with the clinical problem, there's lots of social problem, psychological problem, and then also supporting for the patient. So every bits of experience helps in this speciality mainly, isn't it? And we treat it as a holistic approach.
I like that aspect of GP. That holistic, that it's not just symptoms that you're diagnosing and giving medication, but you're looking at the whole picture. And I really like that aspect.
Agree. And also I believe that you're not treating the disease, you're treating the patient or the person, isn't it? That's most important. And how is your experience working, as you said, in the GP placement as a foundation doctor, and it's been a couple of months, isn't it? So how is your experience from
the beginning? So I think it's been 3 months now, which is crazy, but I think it was definitely very challenging at the beginning, because I'm used to hospital-based medicine, and you have access to things very quickly, and it was just very different. And also during medical school, I didn't have any experience with like telephone consultations, so that was a new skill to try and practice and things like that. But I'm starting to really enjoy it, like the kind of relationship that you can build with patients, it's kind of a personal relationship, because of course we refer patients to hospital, but I feel like we're the overarching kind of person taking care of them and their health if they have any problems, and I quite like that aspect and that holistic aspect that we have. So even though it is really difficult, and I think people underestimate how difficult it is, because you have a limited time to kind of get all the information that you want, and sometimes people can be very sick, or you don't want to miss anything, so that kind of stress sometimes I need to kind of work on sometimes. But like, yeah, I think it's really rewarding, and I've really enjoyed it.
And also, you did mention about the teleconsultation, which is again new for like all of us. It's the post-COVID, the significant changes, the way we practice in the past, isn't it? Because it's a lot to do with the telephone call, and then things might not be same. And also, we were discussing yesterday the role of the other aspect of the GP is not only to clinical, but also listening and supporting patients through the difficult journey. So where the the listening skill and communication skill plays the vital role. And it's not necessarily everyone have that skill, but we can build that skill, and that's the skill we can learn, and then we should be learning, isn't it?
Yeah, for sure.
Okay. And the one last question. How did you feel support wise as a role of your mentorship, or the support you have received during this placement? How that has impact on you?
I had a really good mentor, Dr. Chester.
Thank you so much.
I felt really supported. I think I was worried at the beginning of the GP rotation, like what the expectation is for us. But I think I soon realised that there is a lot of support at this practice, and that if we do have any concerns, because we are still very much at the beginning of our career, so we're not expected to know everything. So for safety of patients, sometimes it's good to kind of get advice from our senior colleagues and our mentors to help us through kind of different patients that we're seeing, but also just like personally as well, like in terms of managing the stress and the different kind of stress, because hospital is a complete different kind of skill set. So I felt really supported, and definitely.
That's very important, isn't it? And also it's like the going through different phase, and then and also it's like, as you said, it's sometimes it could be sick patients, and it could be difficult the clinical complex cases,
for sure,
and making sure the patient's safe, and making sure the time management is quite a lot of things. And also as a supervisor, so our role is not only to give you the advice what to do, but also build your own confidence, looking into your the strength, and then build, and then if there is any weakness, build on that. Is our the main role. And then we hope all the the trainee have get that support, isn't it? That's really important, because it's sometimes difficult to see if sometimes the trainee or you have may not realize that what can they learn, and then they struggle, isn't it? And then once if they don't know the weak point or the weak side, they don't know how to build improve that, isn't it? The main message, other message I could say, is sharing the difficulties with someone who you could it doesn't have to be a supervisor, but good with anyone to say how you're going through whether it's the personal or whether your educational needs. I think the sharing is so important, isn't it? We always learn from each other, because for me is I always learn from you as well, from everyone, we use. And the GP is one of the specialty. There's always something new, isn't it? There is always it's never the enough, isn't it? So learning process should always be there.
For sure.
And good rapport between the trainee and trainer should be always there. That's the most important thing. And in terms of choosing the specialty, no harm taking the time out if you don't know what you want to be. And again, GP, the beauty of general practice is, even though you have taken some other specialty and you feel like this is not something I want, then you can always come to general practice if you like general practice, because every knowledge is important in the general practice.
Very
is
true.
it? Okay. Anything you would like to share?
I can't think of anything, to be honest, but
Thank you so much for your time, Dr. Marsh, and I hope that people find this useful. And if you like, please like, share and subscribe. And if anything similar videos you want to do, then we will be more than happy to redo the other stuff related, the non-clinical things or the training programs. Okay, thank you so much for watching us. Thank you. Namaste. Thank you.